Does your practice run at optimal speed, optimal efficiency, 100% of the time, 100% of the day? The answer to that question for any practice is more than likely no. Managing the many variables of a practice from clinical, staff, and patient flow can involve difficult decisions. There is increased demand in today's environment for streamlining and optimizing patient flow from when a patient walks in the door to when they walk out the door. The EXPEDITOR patient flow system is not just a concept, it's a complete door-to-door patient flow solution. Our lean strategic advisors sit down with you and help you determine your most efficient and optimal door-to-door patient flow operation. Our team will perform a waste walk with you at your facility to see if there are any wasted steps in your process. We'll also put together a value stream map to illustrate the most efficient operation for your practice's patient flow. Then we will help determine what patient flow technology solution that can help you improve the patient experience by eliminating unnecessary wait times while increasing staff productivity and achieving maximum levels of efficiency. EXPEDITOR has patient flow technology solutions that quickly let you know where patients are waiting and which patient has been waiting the longest, the location of patients, physicians, nurses, and staff, and when and where assistance is needed. Our technology offers a solution for practices of all sizes that are interested in driving higher profitability while continuing to deliver quality patient care. To measure the effectiveness of the EXPEDITOR patient flow system, we'll install X-Track Performance Monitor to capture and measure when the patient checks in and is roomed, how long the patient waits in the exam room, how long the doctor and nurse spend with the patient. Then, as the patient checks out, we will collect their checkout time to complete the overall door-to-door patient visit time. With X-Track, the patient simply checks themselves in by selecting the doctor they are seeing. Type in their full name and select their appointment time from a pull-down menu. Once the patient has checked in, the receptionist will select Process to indicate they are processing the patient's paperwork, and Ready when the receptionist is ready to alert the nursing staff that it's time to room the patient. When the nurse is ready to room the patient, they select Roomed and go get the patient from the reception area and place them into an exam room. Once the patient has been roomed, the EXPEDITOR Lite system will capture patient wait time in exam room, the patient-doctor encounter time, and how much time the doctor spends between patients. Once the doctor has completed the exam and the patient is ready to leave, the patient will walk to the checkout counter, the checkout person will select the patient's name and either move the patient to another doctor, lab, or X-ray, or simply check out the patient. While the patient is checking out, we'll capture patient satisfaction survey results where we will measure patients' perception of their visit. Patients will select the doctor they saw and will be asked to fill out a simple satisfaction survey. We will compile this data and publish it to an online dashboard where you will be able to see practice door-to-door times along with doctor and ancillary staff performance times. We will analyze all of this data for you, then set up a time to advise you on the steps needed to improve overall patient flow efficiency in your practice. Stop relying on manual flipping of flags and other outdated methods of patient flow, and stop thinking that EHRs will make you more efficient just because they are on a computer. Being reliant on EHRs means that you must be tied to a computer, and interfacing with the computer slows your practice down and keeps you from seeing more patients. Let EXPEDITOR offset the inefficiencies of EHRs by removing all patient flow bottlenecks and bring in efficiencies that will allow you to see more patients. We are confident that our solution will give you back at least 30 to 40 minutes for each doctor each day, resulting in the opportunity to see an additional 1 to 2 more patients per day per doctor within 3 months of use. Learn how EXPEDITOR can provide comprehensive lean patient flow solutions for your practice by visiting our website at expeditor.com or by calling 800-266-8158.